Circulatory shock. It's a condition that sounds alarming, and for good reason. It's a medical emergency where your body's circulation system isn't delivering enough oxygen-rich blood to your vital organs. This lack of oxygen can cause serious damage and even be life-threatening if not treated quickly and effectively. Imagine a bustling city with a sudden power outage. The lights go out, transportation halts, and essential services shut down. Similarly, when your body goes into shock, it's like a major disruption in its internal systems. The heart, the powerhouse of your circulatory system, struggles to pump blood efficiently. Your blood vessels may become too relaxed or too constricted, affecting blood flow. Your blood itself might be lacking, either due to loss or an inability to clot properly. Understanding circulatory shock is crucial because it can happen to anyone, anytime. Recognizing the signs early and seeking immediate medical attention can make a world of difference. Circulatory shock can occur in different ways, each with its own triggers. Hypovolemic shock is due to significant blood loss. Cardiogenic shock happens when the heart can't pump blood effectively. Distributive shock involves problems with blood vessels. It can be caused by severe allergic reactions or sepsis. Obstructive shock occurs when blood flow is blocked. Circulatory shock doesn't happen all at once. It usually progresses through stages. The first stage is non-progressive shock. Your body's defense mechanisms kick in. Your heart rate increases and blood vessels constrict. Your body tries to conserve fluids. As shock progresses, it enters the progressive stage. Blood pressure drops and vital organs suffer. This stage requires immediate medical attention. The final stage is irreversible shock. Multiple organ failure occurs and death becomes a real possibility. Section 4. Recognizing the signs. Symptoms and effects of shock. Recognizing the signs of shock early can be life-saving. It's important to remember that symptoms can vary depending on the type and stage of shock. But some common red flags include a rapid, weak pulse, which means your heart is racing to compensate for low blood pressure. Shallow, rapid breathing as your body is trying to take in more oxygen. Pale, cold, and clammy skin, indicating that blood flow is being directed to vital organs. Confusion or disorientation, because the lack of oxygen is affecting the brain. Nausea or vomiting, since the digestive system is also impacted. And decreased urine output, meaning the kidneys are not receiving enough blood flow. These symptoms are your body's way of sending out an SOS signal. Ignoring them can have dire consequences. Remember, early detection and immediate medical attention are paramount in managing shock effectively. Section 5. Treatment and intervention. Combating a silent threat. Treating circulatory shock is a race against time. The goal is to restore adequate blood flow to your vital organs as quickly as possible and address the underlying cause of the shock. One of the first lines of defense is fluid resuscitation. This involves administering intravenous or IV fluids to increase blood volume and raise blood pressure. Think of it as refilling the garden hose to restore water pressure. Medications can also play a crucial role in managing shock. These may include vasopressors to constrict blood vessels and increase blood pressure, inotropes to help the heart pump more effectively, and medications to treat the underlying cause of shock, such as antibiotics for sepsis. Oxygen therapy is another crucial intervention. Providing supplemental oxygen through a mask or nasal cannula ensures that vital organs receive an adequate supply. It's important to remember that treating the underlying cause of shock is just as crucial as managing the symptoms. This might involve controlling bleeding, treating infections, addressing heart problems, or relieving any obstructions. Section 6. The importance of vigilance, monitoring, and care. Circulatory shock is a serious condition that requires close monitoring and continuous care, even after the initial crisis has been averted. Once the immediate threat has subsided, the focus shifts to preventing complications and ensuring a full recovery. Patients who have experienced shock need ongoing monitoring of their vital signs, including heart rate, blood pressure, breathing rate, and oxygen levels. This allows healthcare providers to detect any signs of deterioration and intervene promptly. Depending on the underlying cause and severity of the shock, patients may require additional support, such as mechanical ventilation to assist with breathing, dialysis to support kidney function, or surgery to address specific injuries or conditions. The road to recovery from shock can be long and challenging, but with prompt recognition, aggressive treatment, and attentive care, the chances of a positive outcome are significantly improved.